Good evening. My name is Kristen Austin, and I'm doing my project this afternoon on Canada's healthcare system. Canada is a fruitful country with about 33 million people. Despite the recession that began in 2008, they were able to stay strong and reduce the rate of taxes throughout the years. 18% of Canada's population is under the age of 15, and 17% of the population is over the age of 60. French and English are the primary languages spoken in this country. The demand of healthcare services is so high, the wait time for appointments and specialized or primary doctors are very long and frustrating. Healthcare costs continue to rise at rates that exceeds economic and government revenue growth, which raises concerns about the sustainability of health expenditure financed through the public sector. The Constitutional Act of 1867, formerly known as the British North American Act, was responsible for regulating hospitals, local and private matters surrounding healthcare in the 10 provinces and 3 small populated northern territories. Um, Canada's healthcare was privately delivered and funded before World War II. Over the years, things changed, and the government of Saskatchewan introduced universal health care. The Hospital Insurance and Diagnosis Service Act was passed in 1957, which offered to reimburse or cost share half of the cost to the territories and provinces for specific hospital and diagnosis service. In 1962, Saskatchewan government introduced the first public health care program. Doctors walked out on strike, which lasted for about 3 weeks. In 1966, the Medical Care Act was passed, which permitted reimbursement or share costs of one half of the cost for medical insurance provided by the doctors outside the hospital. Prior to this point, doctors were able to charge whatever they wanted, and bankruptcy to pay for health care was common. Now citizens were able to receive portable, comprehensive, and universal access to necessary physician and hospital service, regardless of ability to pay. In 1984, the Canada Health Act was passed, which placed the federal hospital and medical insurance, which replaced the federal and hospital and medical insurance act. By 1995, Paul Martin Jr. introduces Canada Health and Social Transfer, which caused major cuts to transfer payments to health and social programs, and it cut spending from 10.2% to 9.2%. By spring 2007, all provinces and territories publicly committed to establish a patient wait time. In priority clinical areas by 2010, and to undertake pilot projects to test guarantees and to inform their implementation. Next, we will move on to the structure of the healthcare system. Canada ratio in practicing physician versus the population is below the OECD average at about 75,124 in 2012, with a gross average salary of 328. Nurses are another important group that doesn't make as much as the physicians, but still play a vital role in the healthcare system. Each provinces pay nurses different salaries, which can range from 70,000 Canadian dollars, 51 in Ontario, 51,000 in Canadian dollars in Quebec, and a minimum range of 53,000. but some nurses make over 500,000 in Canadian dollars. There are other key groups of healthcare professionals, which include dentists, optometrists, laboratory and medical technicians, therapists, psychologists, pharmacists, public health inspectors, and speech language pathologists. These healthcare professionals are broken down into three different groups. Primary group, which is the first people that you see, primary doctors and group doctors. Your secondary care services, which is more broader, is your emergency care, diagnostic testing, and prescription drug therapies, counseling, and etc. Financing for Canada's healthcare system is a single payer healthcare system, which is federally funded, and it funded and transferred promises as a combination of cash contribution and tax points. It is also financed by taxation, both provincial and federal, personal and corporate income taxes, and lottery proceedings. Public sector funding represents about 72% of total health expenditures. The remaining 28% is covered by private insurance, employer-sponsored benefits, and direct out-of-pocket costs. Out-of-pocket. Language is the biggest barrier in interventional portion. There are long wait times for MRIs, 12.3 weeks, for a CAT scan, 5.5 weeks, ultrasound, 3.4 weeks. Most Canadians would rather pay out of pocket than to have to wait so long. The Ministers of Health and Health Promotion, Healthy Living of Canada prevention priority is to prevent and to educate, which is the key to good health care. Making sure that every Canadian have access to the appropriate products and clinics in their area. Teaching healthy living, changing risk factors and conditions that lie outside of the health sector are the priority of the Canadians. There are major health issues that derive in Canada. Cancer is the leading cause of death, following heart disease and cerebral vascular diseases. Sexual transmitted diseases and antimicrobial resistant infections are on the rise. 8,000 deaths occur due to opiate overdose. Most of the resources come from men. The women stay at home while the men work. That is some of Canada's belief. Many people that are in the rural areas are discriminated against and have harsh treatments, and they just prefer to stay in their community and to seek treatment instead of going to local hospitals. A lot of women that have babies prefer to stay at home and have midwives come in or go to a maternity clinic. In the words of Frog, everything is free, but nothing is readily available. This quote means a lot. Canada's healthcare has a very good concept, but there are many problems that will have to be that must be continually worked on to make the healthcare system a great one. Focusing on quality assurance and the role of pharmacists in reviewing their list of services that are provided, ensuring that they are financing high quality service directed towards health gain. Canadians will continue to develop through an evolutionary process that it will be renewed and reflected. It will be renewed to reflect a newer and better vision of healthcare. Thank you.